Lysobact spray is a combined drug, the action of which is due to its constituent components. Active ingredient: Lidocaine, Lysozyme, Cetylpyridinium chloride. Indications: symptomatic treatment of sore throat in infectious and inflammatory diseases of the pharynx and larynx, acute and chronic pharyngitis, pharyngolaryngitis, tonsillitis in adult patients as part of complex therapy. How to use: locally, by spraying of the mucous membrane of the oropharynx. Applied after meals, 5 injections per application, 3 to 6 times a day with a minimum interval of 2 hours. The course of treatment is 5 days. It is recommended that the drug vial be used by only one patient. Before using Lysobact for the first time, remove the plastic cap from the dispenser. After that, you need to pat the spray on the dispenser with light pressure. The sprayer can be moved to the side, which ensures adequate distribution of the spray throughout the oral mucosa. The atomizer must be turned up at a right angle with respect to the vial. Before the first use of the spray, press the dispenser several times until a uniform spray is obtained. Open your mouth wide, direct the spray towards the affected area, and press the dispenser several times in accordance with the recommendation for dosing the drug. Hold your breath while spraying the drug. Do not swallow the drug. After applying the drug, the sprayer should be turned down, which leads to blocking its spraying. Contraindications: hypersensitivity to lidocaine hydrochloride and other local anesthetic of the amide type, Lysozyme hydrochloride, cetylpyridinium chloride, as well as to any of the components of the drug. Hypersensitivity to egg protein, open wounds of the oral cavity, children under 18 years of age. Efficacy and safety have not been studied. Pregnancy and breastfeeding period. Side effects: as side effects, allergies can occur, manifested in the form of bronchospasm, quincus edema, and urticaria. Erythema was very rarely observed. Special instructions: Lysobact should not be taken with milk, as it reduces the antimicrobial activity of cetylpyridinium chloride. The drug is not recommended for use in the presence of open wounds in the oral cavity, because cetylpyridinium chloride slows down wound healing. Lysobact does not contain sugar and is suitable for use in people with diabetes. During the course, it is not recommended to drink alcoholic beverages, as alcohol can weaken the effect of the drug.